So good
We
morning.
have very few candidates for that course.
I am one of them.
You are?
Yeah.
Okay.
Good morning, judges and everybody else present here. I will be presenting on non-compliance for wearing spectacles in school-going children in South India. So as all of we know, refractive error, they account for major cause of impaired vision in most school-going children, and various community-based population studies have also revealed that refractive error are the major cause of impaired vision in school-going children. And refractive errors, they have significant economic and effect on economic and education, including poor academic performance and reduced social participation. So the purpose of study was to study the prevalence and determinants of compliance with spectacle wear among school-going children in South India who were given spectacles free of charge under school vision screening program. So this was a cross-sectional descriptive study, and the participants were recruited from school from Tirunelveli and Tuticorin district of Tamil Nadu, and the school vision camp were conducted by Arvind Eye Hospital, and this project screening was done under Lavelle Pediatric Eye Care Project, which was for overall 3 years, and of the 1,29,720 children examined from 249 schools, 4,253 children had refractive error and 333 were prescribed and dispensed glasses. And on follow-up, field coordinator interviewed 648 children who were not wearing glasses, and interview was done by field coordinator at 3 to 6 months of initial dispense of glasses. So coming to result, 2/3 of participants were not wearing their spectacle at examination. All the participants were from age 5 to 15 years, and majority of them were in age group of 11 to 15 years, and 50% of them were male children. So this study revealed that at time of examination, 506 children were they were having glasses with them, but they were not wearing, and 177 were even not having glasses also, and they were not wearing glasses also on follow-up. So table 1, it describes the demographic characters of all the participants.
Can you see it?
No, actually there is very detailed, this is again, even I have to cut short it is.
Divide it into 2 slides.
Yeah, okay, ma'am.
That is the way to do it. Anyway, go ahead.
So these were a demographic characteristic and financial status of the parents, education of the parents, locality of the participants, and fathers and mothers' occupation. So on analysis, all these factors, they were not significantly related to the compliance of the glasses. The glasses, this table shows about the glasses wearing time period, that out of total 506 children who were sometime wearing glasses, 240 children, they were wearing glasses for 8 hours, 183 were wearing in school for 4 to 8 hours, and 58 children, they were occasionally wearing glasses, 25 were wearing less than 2 hours. The most common reason for not wearing glasses was headache or watering. Second cause was breakage of the glasses, and third was friends teasing. While vision not improving with glasses and fear to use spectacles were the least responsible classes for not wearing glasses. So coming to conclusion, lower compliance with increasing age has been reported in 3 observational studies from Mexico and Chile, and in India 3 studies have been reported regarding this compliance, and all of the studies suggest that younger ones, they are more compliant with glasses. And in a meta-analysis by Dhirer et al. With 23 cross-sectional study, the compliance overall compliance with spectacle was 40.14%, and the main reason where non-compliance were that either the glasses were broken, forgetfulness, or parent disapproval.
You'll have to wind up.
Yeah. So coming to conclusion, compliance with spectacle wear is even poor even if they are provided free of cost, particularly in children with age group of 5 to 15 years, and factors like type of school, parents' income, their locality, occupation, and education were not significantly affecting the compliance of spectacle wear. So proper encouragement and counseling of the parents and child becomes extremely important. Thank you.
How would you encourage wearing of glasses? What is the remedy? You've given us the problem.
Yeah.
What is the solution?
So we have to actually counsel the parents, because this project was done under a level A eye care project, which was for almost 3 years duration. So in this project we were even educating the school teachers. School teachers were actually, they have done the school screening, and on the children who were actually called for checkup, parents were also called for, and we have so many educational talks, CME for even CME for school program for headmasters, school faculties. So by this we can aware the awareness, but mainly the awareness was for teachers and
It should be for
head
parents.
Yeah, so parents, only the parents who were, if children were having defective problem, then only parents were called. Those children who were not having any refractive error, then parents.
Obviously. Why would you call them?
Yeah.
There's one more.
I'll tell you something. The main reason, what I feel behind children not wearing glasses is very often us. We ophthalmologists, when we get a patient, a child who's accompanied by his parents, we don't emphasize the need to wear glasses full time. We tend to take it very lightly, and we tell the parents also accordingly, because we don't want to scare the parents. But I think we should scare them. We should say constant wear. See, if there is a refractive error of minus 0.5, minus 0.75 in a child who's aged 5 or 7 when he comes to you, why don't you recommend using the glasses full time? Why should you say use it only part time? Because then the part time becomes hardly any time. This is my observation from my years of being in practice as well as working in medical colleges. It is we who are at fault to a large extent, because parents say कि डॉक्टर ने तो बोला ही नहीं था कि सारा टाइम पहनना है. उन्होंने तो बोला था हाँ थोड़ी देर पहन लेना, पढ़ते वक्त पहन लेना, स्कूल में पहन लेना, और जब स्कूल जाता है तो बच्चा स्पेक्टिकल्स अपने बैग में रख देता है, and the teacher doesn't know about it that he is supposed to be wearing glasses. Yes, but you are right that the teacher is a very important link, because if the teacher tells the child to wear, he will wear, even more than the parents.
More than the parents.
So that is a good project that you all are conducting.
There is one more point. The major finding was of not wearing is headache and watering.
Yes.
So is there anything wrong in the refraction or wrong
Yes.
spectacles were given? Because like it should not be there. No headache and watering if you are giving
See,
it for that
They are
purpose.
saying, they are complaining, so
No,
we don't
but then
know.
did you all investigate why that complaint is there?
No, that investigation that we
Why
have
not?
not, because we have not
Yeah.
gone back and see the analysis that how much was the power, whether it was low refractive power, whether it was low refractive.
She has a point.
Yeah. So that thing we have
See,
not.
the child's problem should go away
Yeah.
after wearing spectacles, not remain with headache and watering.
Yeah.
No child is going to wear spectacles.
So that's what, that we have not analyzed, that whether it was the initial time when they were given glasses, that time they had that complaint, or after wearing for 2 or 3 months, we have not done that detailed analysis, whether it was the initial time when we have prescribed the glasses, that time child was having headache, or after wearing for a long time. If he is wearing for a long time and then having headache, then maybe it can be because of
So, maybe going into the reasons for not wearing glasses and rectifying them can be your next paper.
Yeah.
Can be your next project.
Okay, thank you.
Thank you.